After your surgery, if you had liposuction performed, you will stay compressed in the dressings that we placed you in for the first 4 to 6 days after the procedure. This means that you will not shower on a daily basis, but you will sponge bathe on the untreated areas. If you've only had a tummy tuck procedure and no liposuction contouring has been performed, you may shower the next day or two after the procedure. The cleanser that you use for this shower should be an antibacterial soft soap or body cleanser. I encourage you to lather up your hands using your bare hands to clean the surgical site. There may be single white tapes that are placed along the incision. These are called steri-strips, and it's okay to shower over these areas. Pat your surgical site dry very gently with a clean towel, and your shower is complete. Whether it's liposuction or a tummy tuck or a combination of both, it is important that you do not apply any heat or ice to the surgical sites whatsoever. Many of my patients will say, well, my back is sore and I want to place a heating pad in that area. And the answer is no heating pads whatsoever. You run the risk of damaging the skin or burning the skin. Likewise, if you use ice on the skin, your skin sensation has been altered and it cannot give you the signals that you need to know if damage is being done. You may have a compressive garment in place. This compressive garment might be a binder that is either 3 or 4 panels in width. It may also be a body garment like a large Spanx or something that covers the thighs, legs, and upper torso. Regardless of the compression garment, it is important that the first time you remove this on your own, you have help. It needs to be done slowly because sometimes it can make you a little lightheaded as you take it off. And we want to make sure that you have somebody with you as you first remove this garment. Rarely is that the case, but we just want you to know ahead of time. Your procedure may involve drains. Drains are a very important way for us to remove any healing fluid that can accumulate that could potentially damage the result. Each drain is sealed with a special dressing for the first week. This dressing is to stay in place until we see you in the office. You are to record the output from this drain every day, twice a day. We prefer a time like 8 a.m. or 9 a.m. and 12 hours later around 8 p.m. or 9 p.m. This measurement is to be written in cc's or milliliters. Quite frequently, patients will write this down in ounces, and it's very difficult for us to follow. The drains will stay in place until they meet criteria, and we'll remove them typically one by one, a few days apart. Bring your drain log with you when you come see us in the office. After your abdominoplasty procedure, I do want you up moving around. And once you get home from the surgical facility, here are the things that I want you to do first. Having something to eat is a good thing to do after your tummy tuck. Although I don't want you eating a huge meal, soup and crackers or a small sandwich could be something that will hit the spot. You haven't had anything to eat all day, and so this will be the first nourishment your body really receives. After that, I suggest that you take a small nap, and then I want you up and about walking around your home. On the first day of surgery, I want you to take a few 10-minute walks, one in the afternoon and one later in the evening prior to going to bed. Dinner should be consumed at the dinner table. That's important because I want you to start feeling that, yes, I had surgery, but I can still do some normal things. I want you walking every day, 10 times a day, minimum. And I want you walking for at least 5 to 15 minutes at a time. Now, these walks are going to be pretty slow because the way I've repaired your muscles or removed extra skin from the tummy with a tummy tuck procedure have you in more of a bent forward, or we call half beach chair position. And this position allows you to take tension off of the repairs performed. This will get better beyond the first week. So what I encourage my patients to do is slowly, starting around days 8, 9, or 10, start to stand up a little bit more upright, so that by the time you're at day 14, you're really standing nearly vertical. This is really important because after 14 days, I don't want you hunched over anymore. Further, I want you to work on some lung exercises, and this will be done with what's called an incentive spirometer. This is something that we will give you at the surgical facility and allows you to take some nice deep breaths, opening up the lungs and exercising the lungs. The #1 cause of fever in the first day to 2 days after surgery is typically because the lungs aren't getting exercised. So if you do spike a fever and it is above the 100.4 mark that we've instructed you to pay attention about, I want you to give us a call and let us know. But most commonly, this is because you're not exercising your lungs. And so I'll encourage you to use your incentive spirometer 10 times every hour while you're awake. One of the most crucial timelines is the 8 to 12 day time frame. During this time, you'll have already seen us at around day 6 or so, and you may slip into a phase of not feeling like yourself. And this is a really normal phenomenon. We like to call it the roller coaster. Now, these feelings are very normal, and that's why I want you to know about them ahead of time. Most frequently around days 11, 12, 13, you come out of this funk and you're feeling great. And you're glad you did this procedure. By this point, we've removed all of your drains, we've seen you a few times, and you are well on your way to starting to get back to doing the normal things you do on a daily basis. One of the most frequently asked questions that I get is, when can I take a bath after my surgical procedure? And the answer to that is once you're fully healed. It is important because the hot water can cause additional swelling to the areas that we've treated. In addition, I don't want the incisions submerged underwater until they're fully healed. For any type of bathing, exercise, or activity, make sure that you're showering in the upright position. Give us a call at 512-288-8200 if you're experiencing any of the following: infection, nausea, constipation, hives or itching, excessive pain, bleeding, or swelling, or any other incisional questions or healing problems. All of our patients are patients for life, and that means that we'll be following you for many years to come. And photography is a very important part of this follow-up process. We're very excited that you're having the procedure that we've outlined for you. And while it might seem overwhelming or daunting that we've given you so many instructions today, these instructions are meant to make sure that you have a safe experience. I want you to understand that our core values start with safety, followed by excellence, lifetime partnerships, and being responsive to your needs.